Hey, what's up everyone? Dr. Stein over here at Straightahead Chiropractic. Hey, one thing that we see a ton of in the office is ear infections, and specifically kiddos that are struggling with recurrent ear infections and just can't seem to break that cycle of sickness. I recently had one of my former students reach out to me and ask if he could borrow a PowerPoint, a lecture webinar thing that I had created, and I went to look for it to share it with him, and I couldn't find it anywhere, but thank goodness it's all up here. So I want to take a little bit of time and talk a little bit about anatomy, physiology, a little bit of neurology, and really break down the mechanisms of ear infections, because 65 to 80% of kiddos in the United States by their first birthday will experience or at least be diagnosed with an ear infection. It is the number one reason that antimicrobials, specifically antibiotics, are prescribed in the young population and kids. And it's the number two reason for doctor visits in the young population. And so one of the things that I can say from our experience is we have seen literally hundreds of kiddos with cases of ear infections and have seen them successfully, meaning parents have gotten the results that they want. We have had over a dozen kiddos that were literally scheduled to have tube surgery, where they actually put a tube in the tympanic membrane to equalize pressure and allow for drainage. And in those cases, all of those that had committed to care and followed through with the care plan, none of them ended up getting the surgery. And multiple of those had actual hearing deficit, measured hearing deficit, that at the end of care had been restored. That's not to say chiropractic treats ear infection. That's to say chiropractic normalizes the body's function and efficiency. And when that happens, a lot of things, a lot of good benefits, side effects, so to speak, can happen. So let's break this down and chat about it a little bit. So here is our little guy, right? I apologize if my drawing is not good, but hopefully it suffices for this video. And primarily we're looking at the ears for the ear infection. And so what I did is basically blew this up into and kind of did an x-ray vision, so to speak, or an internal vision. And so all this stuff hopefully is going to make sense by the time we get to it, or by the time that this is over. But this blown up in the ear specifically, and looking at the middle ear, which is what's right here, you have the external ear with the tube, right, which is where you stick your finger in there or you use a Q-tip, hopefully not too much. You don't want to go too far, or else you can hit the tympanic membrane. The tympanic membrane, another fancy term for your eardrum. You don't want to push too far, and you don't want to pop that. One of the things that we see, or a couple of things that we know, is that a good majority of ear infections are self-limiting, meaning the standard guidelines as set forth by the American Medical Association is a 3-day wait period, which means if you suspect a kid might have an ear infection, you wait for 3 days and see if the body is able to do what it's designed to do, regulate and heal on its own. Beyond that, then you might need some interventions. Why is it that kids might be more susceptible? There's a whole bunch of reasons, and I want to give you just a few right now. Some of the proposed reasons are that when we talk about the Eustachian tube, which is right here, it's on the inside of our middle ear, on the inside of the tympanic membrane. So going deep here past the eardrum, the Eustachian tube actually drops back into the back of the throat. Now that's important for drainage. In kids, it's a little bit shorter, it's a little bit softer, and it's flatter, meaning it's more horizontal, and it's smaller. And so what that means is that in adults, it's a little bit longer, it's a little bit more rigid and stiff, and it's a little bit more vertical. Now, the theory is, or a theory that has been proposed, is that, well, in kids it's more horizontal, so they're more susceptible to accumulate fluid, which then allows for bacteria to culture and cause an infection. The problem with that is that's not exactly good physiology, because that's not exactly how the ear drains. It's not, it really is not a gravity feed system. Just like swallowing, you can put water in your mouth, but it doesn't go down until the muscles actually constrict and milk that down and allow for the passage, right? Same thing, you could flip yourself inversely. You could do a handstand or some other college tricks on a keg, right? Drink some fluid or put some fluid in your mouth, do a handstand and you're still able to drink, and you're going against gravity, which means that it can't just be a gravity feed system. The Eustachian tube is very similar to that in that there is peristalsis, which is a squeezing mechanism or milking, which we'll talk about in a second. So a couple things that I want to talk about in younger kids that are probably more realistic is there's increased mucus production. Kids drool a lot, so they just have more oral fluids than adults do. The other thing too is in feeding. If their latch isn't very good, if they have more of an open mouth and they're more of a mouth breather, and their adenoids become enlarged, then that can cause some complications as well. So if they are bottle fed, or if they're getting like a formula that may not be the most ideal, and I'm not passing judgment saying don't do formula, only do breastfeeding, because you do you, and make the best decisions for your family. But what we know is that the farther we veer away from normal and natural, the more our body has to try and adapt and compensate to those things. So the teething increases, and then also bottle. The thing specifically with bottle is that breastfeeding and latch, when we talk just mechanically, we're not talking nutrition here, but when we talk just mechanically, that actually creates a deeper, more solid suck from the soft palate, which these muscles that control the Eustachian tube are closely tied to. And that causes the hard palate to take a better, deeper shape. If the hard palate is not taking a better, deeper shape, then you're going to be a little bit more of a mouth breather. Your adenoids are going to enlarge, and it actually has a whole lot of ramifications down the road from liver enzymes and metabolic syndromes, and there's just a lot of research behind that. All that to say, if your kiddo is bottle fed, that just means that they're more susceptible. It doesn't mean they're guaranteed, and that's not like a condemnation. It just means that they might be more susceptible, along with teething, right? What does teething do? It increases inflammation. So a lot of questions people have about teething is, well, is it an ear infection? Are they sick? What about the fever? Fever is supposed to happen with teething, as is increased saliva and mucus production. Why? Because heat causes molecules to expand, which will soften the gums and allow the teeth to push through. That, along with an inadequate drainage of the Eustachian tube, can create an accumulation of fluid in the middle ear, causing otitis media, which is the technical term for that infection of the middle ear, which then can lead to a slew of other issues or other concerns or other problems. Okay, hopefully you're still with me. I know I'm giving you a lot of information. Let's talk about this a little bit though. So, what is the job of the Eustachian tube? Here's the middle ear. In here are the ossicles. Here's the tympanic membrane, right? It really separates the external environment from the internal environment. And inside are some of the bones that actually vibrate and sense sound so that we can hear things like you're hearing me right now. Well, inside here, there is a hole in a tube called the Eustachian tube. It really is how we equalize our pressure. So what's the Eustachian tube? It equalizes pressure, right? Yawning, popping your jaw, chewing, swallowing, those are all things that are controlled largely by the palate and engage in association with the Eustachian tube. Going down from the mountains or going up into the mountains, chewing gum is one of those things that's really beneficial. Drinking plenty of water while you're doing it is also beneficial. Yawning, right? That whole movement that you do to try and clear or pop your ears, that's what that is, equalizing pressure. It's happening in the Eustachian tube. It protects against reflux, not reflux, but making sure that the content that is in your mouth doesn't go into your ears. I know that sounds kind of gross, but it can happen. The Eustachian tube actually works and has gatekeepers. These muscles we're going to talk about has gatekeepers which prevent that from going down, or actually from going up. The contents in your mouth not going in, okay? And then it drains secretions. There are secretions that are happening, right? There's inflammatory processes and there's inflammation that can get into the middle ear, and that should drain. It should adequately drain. If it doesn't, think of it like a swamp. And stagnant fluid, if fluid gets stuck in the middle ear, stagnant fluid grows nasty stuff. It just does. Would you rather drink from a swamp or would you rather drink from a stream? I mean, you're going to pick the stream. I hope you're going to pick the stream. You don't even want to go near a swamp because it's nasty, because it grows nasty stuff. So that's normal function. Those three things are normal function. Equalize pressure, protect against the reflux or things go in the wrong direction, and then allow for excretion or for drainage, okay? So when there becomes Eustachian tube dysfunction, that can happen in two ways. One is through infection and one is through muscle failure. So let's talk infection. Most of the time, the infection starts virally, right? About one third of otitis media is classified as viral. The other is bacterial. Most of them have a blend. I think 66 or 67% actually have a blend where there's viral and bacterial. But what happens is there's an exposure to the virus. Now, this is the back of your throat. Just think of this as an open mouth here, back of your throat. Adenoids are back here. A virus is sensed, again, more susceptibility through mouth breathing. If your kid has a higher arch, they're breastfeeding well, they're going to be a better nose breather. A better nose breather is going to filter out a lot of these viral issues, and our immune system is going to engage better through breathing through our nose than through our mouth. But anyways, they breathe through their mouth. The virus comes in. The adenoids, which are supposed to be engaged in immune function, do their job, right? They enlarge, they capture this, but they also create an inflammatory response, an immune-mediated response, an inflammatory response, which creates edema, increased temperature, where fever can come in because some of the cytokines and the interleukins will go up to the hypothalamus. Hypothalamus will recognize a problem. It'll heat things up. Why does it heat things up? To burn them off, because they don't like heat. So it makes a hostile environment for the enemy. The enemy flees, okay? So what happens, or what can happen though, is that all of this congestion, right? You get increased mucus production, and this congestion will actually fill up alongside and even possibly coat the Eustachian tube. So if we go up here and look, this congestion creeps in, and now the middle ear, where the ossicles are for hearing, will become affected, because you start putting extra pressure, negative pressure, because this clamps everything down. It creates a negative pressure environment along with increased fluid. And so what ends up happening is these bones here that are supposed to vibrate with frequency of sound or sound waves, that gets muffled. So their hearing drops, and it's painful. It hurts. That negative pressure, it sucks. Literally, that's what it is. It sucks because it's causing a negative pressure, which can cause a whole bunch of pain, and can actually lead to potentially further infection in various ways. So virus comes in, can cause those things, right? What can happen is if the fluid, if an antibiotic is used, let's say medication is used, it treats the bacteria. Remember, it doesn't know to go specifically to the bacteria here. It goes throughout your entire system. But, side point, another video, another time. What happens is the fluid doesn't leave. Did you hear that? The fluid doesn't leave. What do you mean the fluid doesn't leave? Well, the whole issue is that there's congestion, but here's another point. Muscular failure is another part of Eustachian tube dysfunction. So, remember, the Eustachian tube has gatekeepers. It has muscles that work to squeeze and contract and promote drainage, and to lock off and block stuff from getting up there. So if you swallow or you sneeze or you cough, stuff doesn't shoot up into your ears, right? So those two muscles, the tensor veli palantini muscle and the levator veli palantini muscle. I know, you should already expect nerdiness from me. I'm not gonna back down now. The TVP is a division of cranial nerve 5. It's actually the mandibular division, so it's the third division of cranial nerve 5. The levator palantini, or the LVP, is off of the vagus nerve. It's off of cranial nerve 10. Now, cranial nerve 10, along with the accessory and the glossopharyngeal nerve, have a motor component, which is really interesting because the vagus nerve is mostly sensory, and it has a sensory component. Now, let's dive into a little bit of neurology real quick, looking at those two things, and specifically vagal nerve control. The vagus nerve is really how we understand our environment. The vagus nerve is what does the sensory motor system of our vestibular system so that we can really make sense of our environment, so that we can respond appropriately to what we got going on. It does only have a few motor divisions, and one of the motor divisions that it has is that it goes into, it goes into this muscle here, which is part of the soft palate. The part of the soft palate elevates and retracts. So for breastfeeding, how does that mechanism work? It's like a plunger. It allows for the breast tissue to come in, right? And then it draws it in, which makes a more stable latch. When kiddos can't do that well, one, it can lead to a more propensity toward ear infection. The other thing it can do is cause irritability. How does it cause irritability? Vagus nerve. Vagus nerve is in control and charge of our sympathetic response, our stress response. So why is it that kiddos don't feed well or pissed off? One, they're hungry, right? But two, because they're stressed out because the normal natural process they should be able to do, they're not. So their body's going into survival mode, which is freaking them out. That was a tangent side note, bonus material. We'll talk more about that later at some point. But so you get muscular failure. Well, what happens is, the muscles, like I talked about, they're supposed to melt the Eustachian tube, preventing stuff from going in, but also pushing nasty stuff out. So what they should be doing is increasing drainage and increasing ventilation. Well, if these muscles fail, which I'll talk about in just a second, but if these muscles fail, they put things on lockdown. They don't allow adequate and proper drainage. If there's not adequate and proper drainage, this fluid stays here. This fluid stays here. Even if the infection is treated with antibiotics, the fluid stays there. Well, guess what happens if the fluid doesn't go away? If you can't get rid of the fluid, guess what happens? You get OME, otitis media with effusion. What is that? That is asymptomatic fluid in the ear. So you've probably heard people say, my doctor said that my child has fluid in the ear. A lot of times it's after an ear infection. Sometimes it's before an ear infection. Most of the time it's between ear infections. And what that means is otitis, OME, is asymptomatic fluid accumulation. It will suppress hearing, but the biggest thing that it does, makes you susceptible to ear infections. So it makes you susceptible. So you can take an antibiotic, it can treat the infection, but if this isn't draining, guess what's going to happen? You are absolutely right. Another ear infection is going to happen. That's why a good majority of kiddos that have, in this range, 65 to 80% of kiddos that have ear infections in their first year treated with antibiotics are likely to have multiple more ear infections down the road. Kiddos that can hold off and not do the antibiotics and allow the body to go naturally, or dare I even say possibly fix their diet and get some chiropractic care, one and done. If they have an ear infection or if they've had multiple ear infections, once this drainage is promoted, then things get better. Now, here's another thing. What do tubes do? Tubes blow this out. Tubes put a hole in the Eustachian tube, in the tympanic membrane. A hole in the tympanic membrane, what it does is it equalizes pressure. It's like those old school, or not old school, but like those jugs of water that you put in your refrigerator right before refrigerators had like the spigots on them, or the water features on them. You take that in there and you put it and you pull the spigot and it's like nothing comes out, nothing comes out, nothing comes out, until what? You poke a hole in the top and then all of a sudden all this fluid comes out. What happens with tubes is they don't do anything really to fix the problem. All they do is equalize pressure and they shove this stuff in here. Well, all of this stuff in here, possibly stagnant and nasty, gets shoved back into here. What's it do to the adenoids? They get bigger. All of a sudden your kid has apnea. They can't sleep at night. They are mouth breathers. They snore loudly. So what's then the next protocol? What do you do after that? Well, let's do this. Let's just remove them. Let's get rid of the tonsils. Let's get rid of the adenoids. Well, then the question is, where does all this stuff go? Well, it goes down the throat and into the GI tract, or it can actually go into the next defense mechanism, which is our chest and our lungs. So then you see kids that were having upper respiratory issues now having lower respiratory issues. So you start seeing bronchitis, pneumonias, chronic respiratory issues, asthma. Those are really, really common. most of the intakes of kiddos that we do that have asthma now were kiddos that had chronic ear infections back in the day. Okay, by back in the day, I mean like 4 years ago. So pulling all this together, what causes this dysfunction? Well, the increased mucus production ultimately can lead to more fluid, but the lack of adequate drainage and ventilation is what causes the issues. Part of that can be through infection, which we talked about, but even with infection, there should be drainage and your body should be able to handle it itself. The other is with muscle failure. Well, where does this muscle failure come from? Well, if I had to put it in one phrase, one term, one descriptor, it would be birth trauma. Birth trauma, because kids are born unnaturally. Birth is traumatic enough, but now we're faced with situations where everything is monitored, everything is controlled, babies are tugged on, they're pulled on, and the more, again, going back to this whole idea, the more you intervene with natural, normal processes, the more consequences there are. That's just period, end of sentence, bottom line. The more you intervene with how God created things to happen, even if it's necessary, and I'm not saying that sometimes it's not necessary, but you got to understand that the more you go against nature, the more consequences and adaptations your body has to make. Well, these are adaptations. Birth trauma causes upper cervical tension. Upper cervical tension can affect the first 4 cervical nerves or that cervical ganglia. That cervical ganglia is what can control and alter muscle coordination as well as interpretation of how our body is functioning and forming. And general movements. Do this. Tense your neck as much as you can and try and swallow. It's not easy. Tense your neck as much as you can and try and yawn. Also not easy. If the musculature is responding as an adaptation to tension on the spine, it alters the way you swallow, it alters the way you breathe, it alters the way you yawn. And these muscles have attachments close to the skull and the spine, close to the first cervical vertebrae, on the spine of the sphenoid bone. Sorry, I couldn't get it out there for a second. All of which, this is chiropractic, right? This stuff, not so much chiropractic, except for this is abnormal results of dysfunction potentially here. Chiropractic is about fixing it here. So when you look at all of these things, you can do a couple of options, right? You can follow the standard protocol and let's kill the virus, or if it becomes bacterial, let's kill the bacteria. But if your kiddo's struggling with recurrence, right, then it's because the issue has never been addressed. That's what I really wanted to say. Now, 23 minutes into this video, I thought it was going to be like 10 minutes, 23 minutes into this video. And the one thing that I really want to say is, why are they getting an infection in the first place? Right? Because it's so easy to look at the pathogen and go, well, they're the enemy, and they singled out my kid and they took him over, and let's just kill that thing, right? But let's go back a little bit and go, well, maybe there's some susceptibility there. Maybe birth trauma has caused mechanical restriction on the Eustachian tube's ability to drain. If that is the case, well, then it doesn't really matter how many meds you take. There's going to be a reoccurrence that's going to continue to happen. The other thing is, what's your activity level look like? What's your kid's posture look like? What's their normal, natural day look like? What's their diet, right? What are the things that they're doing? How is health being either fostered, grown, or developed, or how's it being hindered? What are the things that are making them more inflamed? Are they just eating nothing but like goldfish crackers and soda? Are their bodies just inflamed? Are they getting the adequate like vitamins, minerals, nutrients, fruits, veggies, all of those things that really promote health? Are they active? Are they exercising? Yes, we're not really going to see that a whole lot in the 1-year-old, but what about the 3-year-old? These are all things to take into consideration, because you're either moving toward greater health or you're moving away. So with that said, at the end of the day, the reason that we have seen so many kids in our office that have been able to avoid this surgery, who have had their hearing restored and who have broke that sick cycle is not because we're doing a treatment on ear infections. It's because we're getting into some of the root causes of why the dysfunction's are in the first place. Chiropractic is and always has been about restoring the body's ability to function at its maximum capacity so that it can self-heal and self-regulate. I hope that this is informative to you. I hope it's not too overwhelming, but I also hope it stirs up some questions because I want to have a conversation with you. If your kiddo is stuck in that cycle and you just don't know where to turn next, maybe chiropractic is not the best fit for you. Maybe our office is not the best fit for you, but I'd still love to have that conversation so that we can help put our arm around you and guide you to where you feel most confident in getting the help that your kid needs, because you and your kid deserve it, and hope is straight ahead. Thanks so much. Bye.